The number of ladies coming with neck pain, back pain, managing on both fronts from home, people tend to use laptops in the wrong way. So eating just before running and not doing stretching afterwards is extremely hazardous.
One everyday item you would ban to save our spine. Don't say mobiles.
Please.
Have you ever corrected somebody with a bad posture in the middle of a conversation?
Keep on doing it all the time. It just happens at a spinal level. There was a young girl, around 11-year-old, who was brought to me on a stretcher, and she had this lesion in her spine. More importantly, the family was extremely poor. The hospital also came up with a complete support as far as finances are concerned. And what I still remember is that girl on the stretcher asking me, "Doctor Sahib, मैं वापस चलूंगी तो?" This was a very, very important thing in my life, that I was reminded that you have to look at such people. And if you are in a position to do the surgery in spite of somebody not having the resources, that's definition of success for me.
Hi, today we have with us one of India's leading spine surgeon, Dr. Rajesh Parasnis, the name that is synonymous with excellence in spine care. With over 2 decades of excellence and 22,000 plus surgeries, Dr. Rajesh Parasnis stays at forefront of treating complex spinal conditions. Not just that, there are numerous patients who he has been treating without even surgeries. He is currently serving as president of the Pune Association of Spine Surgeons. He has trained under global pioneers like Professor Harms in Germany, and he completed his prestigious fellowship in minimally invasive spine surgery from Singapore. His expertise spans everything from advanced deformity corrections like scoliosis and kyphosis to minimally invasive disc surgeries. Known for pushing the boundaries of spine surgery while staying deeply rooted in patient care, Dr. Parasnis is here to debunk myths, share life-changing insights, and help us understand how our daily habits silently shape our spine. So let's dive in. Hello and welcome to another episode of Sahyadri Health Talks. I'm Dr. Tushita, and today we are going to talk about spine health. Today we have with us Dr. Rajesh Parasnis. But before I introduce him, I would want to make one request. This podcast, make sure you watch with your entire family, because this is something which every age group will relate to. Without further ado, let's welcome. Hello, sir. How are you doing, sir?
I'm doing fine. Thank you, Dr. Tushita. It's a great pleasure to be here to share more relevant information about spine care today.
So nice of you, sir. It's really fortunate for us to have some time from you. And to begin with, I really wanted to say this. 22,000 plus surgeries, sir. Such a humongous number. How has this journey been for you? How was the entire journey? Tell us about it.
Quite long. It's more than 30 years now that I'll complete since passing post-graduation, and almost 26 years just doing spine surgery. So I think in any field, if you're persistent and if you keep on doing work, the numbers will come. But what I would love to highlight is not just the number of surgeries, but the number of patients that me and my team have cured without surgeries.
Happy smiles. So, sir, you always wanted to be a spine surgeon?
Not really, not at all.
So, what
Right?
was...
It's a little funny. I hope you won't laugh about it. During my school days, I wanted to be a librarian because I was so interested
in reading?
in books and reading, and a librarian gets to read everything free.
We are so happy you didn't become one.
Then I wanted to be a wildlife naturalist and a researcher. So I still remember my father telling me that choose a profession where you can do the wildlife as your hobby.
Achha.
That stuck on. Then I was always interested in becoming a doctor. That I chose to be a spine surgeon because that gives me immense pleasure, and the passion and the zeal has remained the same over a time.
Yeah, and I think spine is something which, as I said in the beginning of the podcast itself, that spine issues are not age specific. Anybody and everybody can have spine related problems, and these days, so this neck pain, bad postures, all this have become a part and parcel of our lives. So that's what makes this podcast even more interesting, because today we want to hear it all from you about everything which is related to postures. So without going round and round, let me ask you the first question which I wanted to ask you is, what are the few things which you have seen people do in day-to-day life which damages their spine big time on a long run?
The commonest things leading to spine problems, neck and back pain, poor posture, lack of exercise, bad diet, and absolutely a lifestyle which creates more stress on your neck and
मैं
back.
जा रही हूँ सर यहाँ से मैं तो जा रही हूँ. I think I've checked checked all the boxes that you said.
I thought that's the reason you called me, right?
Oh my God. Okay. So, after that, so it is usually said that sitting is the new smoking. Is
Worse than that, probably.
it worse than that?
We call it a syndrome.
Acha.
We call it sitting disease. There are at least 23 to 24 chronic conditions and diseases attached with sitting for extremely prolonged period every day.
Okay.
If you permit, I will just enumerate a few and you'll realize why this is all pervasive.
Sure, please.
Other than the neck pain, back pain, spine related issues, obesity, diabetes, hypertension, varicose veins, deep vein thrombosis, hemorrhoids, even there are certain malignancies attached with it.
Acha.
So you see what happens to human body when you sit for prolonged period is you're using human body which is not meant according to evolution to do something in a very prolonged way. If you permit in minute, I'll just explain to you.
Yes, please.
8 to 10,000 years back, all our ancestors were hunter-gatherers.
Yes.
Each one of them was more fit than the fittest people like Usain Bolt and others today. Then we became agriculturists. Then we started doing sedentary work. But in a very short span of last few decades, we have started sitting for more than 8 to 10 hours a day.
True.
Either for your profession, either for your hobbies, or just because of leisurely time. Your body evolutionary is not equipped to handle that
Such
posture.
kind of
So that
posture for a
disparity
longer time.
leads to such kind of diseases.
So, sir, we have always spoken a lot about sitting in one posture for a longer time. And earlier it was like sitting at office. I'm talking about specific the IT crowd. But post-COVID, working from home has become a new norm. So, like most of these people are still working from home. And, it has even brought some other serious issues or new posture related issues, which is like sitting on the bed, lying on the bed, putting the laptop on the lap, neck bent. So what do you say? I mean, are these even worse than the previous issue which we saw?
Rather than comparing, I would say this is equally disastrous. We used to feel that work from home should actually allow the individual to choose his posture properly, to choose the work hours, and also to have more time in between for frequent breaks and exercise. Unfortunately, we have seen more number of people coming in. So I would broadly categorize into two. One is those who use too much of laptop. So people tend to use laptops in the wrong way.
Yes.
They lie down, as you said, on the bed, or lying prone or recline, and continuous marathon use, whether you do it in the office or you do it in the home, it's going to hit you the same. The second category, interestingly, Tushita, are ladies.
Acha.
This group, why I'm saying so, because when they are at home, they have to do the housework.
Yes.
Plus they have to do the work.
Office work.
And that hits them badly.
Acha.
The number of ladies coming with neck pain, back pain, managing on both fronts from home has just catapulted to a new level.
Oh, that's quite surprising to know that. So what is that, if you have to give for this work from home crowd, people who are still working from home, if you have to give them some advice before that, if you have to give some advice or tips or stretching tips for people who are working from offices for longer hours, exercise tips or something like that.
Absolutely essential. First and foremost is if you are working in a sitting posture for a long time, take frequent breaks. Every 45 minutes, an hour, get up, move around, even for a few minutes, change your posture. Second, after every 2 to 3 hours, do some stretches in sitting down position, even on your chair, right? So if you permit, I'll just say a few because this happens to us also. If you're operating for a long time or staying in the outpatient department. The parts of your body which become stiff are the neck, shoulders, your hands if you're using the laptops, the back, and the lower limbs. So each one should be stretched. The first and foremost is just go back completely into the hip and back stretch.
Okay.
Just recline completely and see how you feel.
Okay. Yeah.
Second is your shoulder stretches on both sides. Okay. Then you just do this for your neck and shoulder stretches. Every 2-3 hours, do this. You will realize which part of your body is getting stiff.
Yes.
Sometimes you don't realize while working because you're occupied, you're distracted. Also for the legs. Make sure once in a while you change the position. You change the posture entirely, stretch your ankles, tighten your knee muscles, recline forward or backward once in a while. But getting up, moving around every 45 minutes to an hour is absolutely mandatory.
Mandate. Correct. And for people who are working from home?
First and foremost, use your laptop like a desktop. Create a workspace.
No sitting on the bed. No
Professional workstation inside your house. Preferably both in sitting position and in standing position. So if you have a previous episode of neck pain, back pain, don't wait for the pain to recur. Once in a while, every hourly, at least for half an hour, stand and work, go back, take more frequent breaks because work from home should allow you that.
Correct. So, sir, another common issues of neck pain, back pain, which we see are, typically during driving. Thanks to Pune traffic, we spend a lot of hours doing half clutch. So, what are the things which a person who drives or gets stuck or commutes to work for longer hours should follow? What tips do you have for them?
It's again extremely important. And one thing I must mention, there are hardly any cars which have ideal ergonomically designed car seats.
Acha.
Only the very high end cars have the modularity, customization as per your lower back, neck, and this. As if spine care is only allowed for the extremely rich. So you need to customize it.
So this lumbar pillow support?
Yes. So the lumbar support or lumbar pillow, what it means that if you look at any individual from the side, your chest has a curvature forward, your back, lower back has a curvature backward. If you maintain that, which we call as lumbar lordosis, your upper back always remains in good shape.
Okay.
And the car seats are essentially
like this
buckets.
Yes.
So you need to customize. You can have the ready-made belts called lumbar supports, or just use a small pillow on your sofa because that will take the shape of your lower back. Do not drive at a distance for a long time. And you can do the stretches once in a while. Don't hunch forward, have bad postures, be tense and drive.
So people who go on long drives or specifically I'm talking about the drivers, professional drivers, or even when we go out on long trips, how frequently should the break be taken?
1.5 to 2 hours is ideal for a tea or coffee break. If nothing else, just park it on the side, just get down and move around. It gets your circulation in the legs going. It is good for your neck and back and overall health also.
Okay. So is riding a bike and driving a car, which one is more dangerous when it comes to spine?
You can compare both. If you're fit and young, either is okay. But
because of late, sir, I've seen these super bikes. In that, the rider holds the
absolutely,
and the spine is literally like this.
Yeah, they are device for spine specialists actually to get more patients. So if you are in a car, the suspension is better. You have a back support. You can customize in so many ways. On a bike, you don't have that kind of liberty.
Correct.
So it is essential that you watch your posture when you're riding. But most of these super bikes are designed in a way that you have to hunch forward and hold it.
Yes, but it's so dangerous.
So driving at a stretch for a long time is not good for your neck and back.
Okay.
I would say the other way around. If you love a super bike, if you want to ride, you take better care of your spine. You have to be that fit that even riding those doesn't give you back pain.
But then you, when it comes to riding those bikes or driving the car, so driving the car is always a better option.
It's kinder for your spine.
Kinder for your spine. So we have seen this, early degeneration of spine in youth. So starting from something which we have seen right from our childhood time, the heavy school bags which the kids carry, does it have a long-lasting impact on their spines?
Long lasting impacts, there is still a lack of research data to say that, but it is very disheartening to see very young and small children coming with neck pain, back pain because the school, bags are heavy and they
Very
have to
heavy.
carry.
Yes.
So, one thing I always advise, and we have seen this in our own households at times, you don't need to carry all the books and
Books
notebooks.
all the days.
Most of the schools give you lockers.
Huh.
So a little effort the day prior, only carry what is necessary. Second, that I have had few kids who really had an organic issue, some structural problem in the spine, to carry trolley bags so that you carry it on the ground rather than lifting and carrying. Now some of these kids can land up in a bad pain or severe pain which will jeopardize their daily activities, but no data about very long-term
Long
effect
impact.
going so, because younger spines, younger bodies for that matter,
They
are
heal
more
from-
resilient.
Yes, correct. So, sir, this scoliosis, does it impact only teenagers?
There are types of scoliosis. Amongst that, the idiopathic scoliosis, which again can start at a very early age, but typically most of the cases occur in adolescence. So they manifest between 10 to 16 years. That is when the height is rapidly increasing and the scoliosis increases. So majority of the people, the children, have to be diagnosed either during school screening or it is accidentally diagnosed when they have some chest x-ray or the parents, they start having observation of the disparity in the shoulder level or a hump on the back. So most of the scoliosis cases which are adolescent idiopathic scoliosis, 10 to 16 is the right time to catch.
Okay. So, sir, because we are talking about, early degenerative changes in spine, of late, one thing which we have seen very frequently happening in young adults or, in young age is slip disc. Very frequently, almost, everybody has known somebody or has been suffering from slip disc. So, what is the reason behind it? Is it again coming to the
Now,
lifestyle and the postures?
we are addressing two issues. You mentioned something, if you permit a minute, let me clarify. It's a very broad, vague term to use, degenerative.
Acha.
What it means doesn't mean something is getting worn out, because the term might create a phobia in a person's mind. Sometimes it's easier to cure the pain, but to take out the fear
From
is
the mind.
extremely
Yeah,
difficult.
yeah,
So people come and tell me that very early I started getting degenerative disc or disc prolapse or slip disc. The MRI nomenclature, the descriptions used by the specialist, is a very vague term, can denote various different stages of aging changes in the disc or spine. So every time you say degenerative doesn't mean that it's a very severe issue.
Acha.
All right, this is
Okay,
first.
okay.
Slip disc can also have different stages. So it's not mandatory that a person needs to be very worried if he's told that you have a disc prolapse or a slip disc, because it could be just the initial stage which can be very well controlled just with minor changes in your lifestyle, posture, regular exercise, weight control. If it is increasing, progressing rapidly, causing symptoms like continuous pain or leg pain, that is the time they have to take a professional opinion, sort out, have a proper protocol of treatment, and in spite of the pain completely disappearing, they have to be careful about their spine.
Okay. So, as we talk about, and we have spoken so much about all these topics and points, you have also mentioned that it's extremely important to keep yourself fit, do regular exercises, and keep your body fit. So, coming to that exercise section, right? So, whenever it comes to workout or exercises, everybody wants to lift weights, weight bearing exercises. So, what is your take on when to start weight bearing exercises, and what should be done when you start before you start the weightlifting exercises?
Right. So, weightlifting exercise or resistance training is extremely important to get your muscle stronger,
Yes.
to maintain your muscle mass, which is equally important for a young person, equally important for an aging person, especially so for ladies around menopause to prevent osteoporosis later on. But if you are not very careful about how you do, what you start with, and whether it is suitable for your body prototype, can lead to injuries and can lead to other problems also. So most important is, if a person is coming to me with pains and aches, and after he is cured, we always advise to start exercises of stretches
Acha.
to gain back the complete functional range of movement of every joint in the neck and back. Then we proceed towards flexibility exercises,
Acha.
which are derived from yogasanas or various other specialities. Then comes the endurance. In common man's terms, this is the stamina, and that's what most of us require. We are not manual laborers who require bulging huge muscles to work, but we need endurance to sustain 12 to 14 hours. Correct? Plus, if you're sitting, your core strength is important. So having that functional fitness for your vocation, for your profession, for your daily life is the first goal. Then comes the resistance training or strength training.
Acha.
And that is when you should initially use your body weight and do functional training. Something like planks, gym ball exercises, pull-ups, push-ups. So these are safer exercises because you cannot exceed what the body cannot take it.
Correct.
But when you start adding weight, what if your ability is to just lift 10 kg and you start lifting 15-20? That is when the injuries occur.
Occurs, correct.
So sometimes it's prudent to have an instructor, to have a partner, to have an observer who scientifically knows what you should be doing. At least in the initial phase, it has to be a graded protocol. Go from smaller weights to bigger weights,
So
less
take it
repetition,
slow,
more.
basically.
Absolutely. So there is no shortcut to fitness. One should not look for a crash course. One of the worst exercises for back is also one of the most favorite for majority people, including me and the instructors, are the deadlifts.
Oh my God.
Excellent exercise,
Yes.
composite, complex,
Yeah.
very beneficial.
Yes.
If not done properly,
Then
probably
complete
that
joy.
exercises has given me more number of spine patients than any other.
Oh my God. So it's that.
I think it's true that anything and everything you've done properly is beneficial. If done wrongly, it's going to affect you.
Correct.
So weight training especially is a little potentially dangerous aspect, but it should be done properly.
Under proper guidance and
it has to be customized.
in
What
a-
is suitable for a
Correct.
60-year-old person who has never done exercise is going to be different from somebody who has exercised all his life.
Correct.
Right?
So it's not
But
one
what
size
happens
fit all.
today is most of us are goal oriented.
Oh.
I'll give an example. If you ask people what kind of fitness you're looking at, they will not say, I want to be fit enough for my daily chores or my professional work. They'll say, I want to run a half marathon. I want to do a half Ironman. I want to go for a 100-kilometer cycling or enter this. So we are all competitive.
Yes.
Good part is when you have a tangible goal, it is easier to attain, create a protocol to achieve it.
Yes.
The fallout is you start competing with fitter people, you forget that my
your body
protocol should be
is-
different.
Yes.
And that's what results into injuries.
So when it comes to fitness, you are one fitness freak person and so much into various kind of activities, including one of those being running. So what are the common mistakes that you have seen runners doing?
Few of the commonest mistakes is trying to progress very fast.
Acha.
Not doing cross training, not doing enough stretching.
Acha.
Second is using the wrong kind of shoe wear or the cadence, the kind of, the posture that you should develop for long distance running. For an example, a sprinter always uses the forefoot.
Acha.
Okay, so their muscle group is very different.
Okay.
As against a long distance runner has to have a very different imprint when the foot hits the ground.
Acha.
Whether your knees are bent or no, how you carry your torso, whether you're leaning forward or no, how your hands are moving, everything plays a role when you're really going for a long distance running.
Acha.
Otherwise, we learn through trial and errors. I remember initially when I started doing, I developed issues.
You also had an issue.
Tendinitis, potential rupture,
Achha.
chilblains. So all this is part of learning.
Acha.
So one has to remember that exercise is also controlled injury to the body. You're training
Okay.
the body to sustain it.
Controlled injury to the body. That's a beautiful term. So you're saying that, actually, I was going to ask you that also, that how important is the shoe, and wearing a worn out shoe or maybe not correct fitting, it impacts the spine while running or maybe cycling.
Of course. So, Tushita, shoe doesn't affect only the spine.
Acha.
It would start from your foot, then
Okay.
your ankle, then your
Joints.
knee,
Ah.
then your hip, then the lower back, and
Then
it can even hurt your neck as well.
neck as well.
It is not just the cushioning. It is also about the insole, also about the proper
Ah.
make of the shoe. I'll give an example. Many of us have flexible flat feet or
Okay.
lace arches
Okay.
or some other different type of foot format. So customizing the kind of shoe you wear for long distance running is absolutely important.
Okay.
Many of these newer shoes, not just Asics, but so many companies have come up with beautiful running shoes to protect your feet, to protect your joint and spine. But if you use it for a long time, it gets worn out. So this is extremely important to protect your knees and spine as well.
So, sir, we have spoken about IT professionals, who are doing work from home, runners, and bikers. One section which often gets missed out are the non-IT professionals who are at risk of developing a spine injury. So, which would be these professions which you feel are at high risk of having a spine injury?
Dentists and beauticians.
Oh my God. Again, I should run away. Okay.
So people have to stand for hours, bend down. Your work is so focused that during that time you are not even aware that you're doing something
Oh,
wrong.
I remember. I remember my neck hurting so bad.
So I have advised so many of my patients who have been dentists or dental surgeons. But then I realized in their profession it is not so easy to control the posture,
Yeah.
the workstation, the way you do. It's easier for surgeons. They are also a high risk group. If you're using a microscope, you bring the microscope to you rather than you going to the
closer
patient.
to the mic.
But for a dentist or a beautician, there are limitations, right?
Correct.
So all the things that we discuss for an IT professional, frequent breaks, avoiding stress, regular exercise is absolutely important for that profession also.
Great, sir. So, sir, moving on to a new section of this podcast, which is like, we can call it as a rapid fire or myth buster. So, just quick questions, which are around the most frequently misunderstood topics or most frequently asked questions. So, one thing to never do before or after a run.
Immediately eating
Acha.
and starting your routine without stretching. So eating just before running and not doing stretching afterwards is extremely hazardous.
Okay. Running barefoot, yes or no?
No,
What's more harmful, overtraining or wrong training?
wrong training.
Okay. Is it okay to exercise with minor back pain?
Yes.
Okay. One spine myth you wish people would stop believing. I know you hate this one word, but
That slip disc is a dangerous thing, and second myth, spine surgery is extremely risky.
Risky.
It's a myth.
It's a myth. Okay. Okay. Texting neck or gaming hunch, what's worse?
Equally bad,
Equally bad.
but I would say texting because everybody does it. Gaming, only a few.
Okay. Worst posture, slouching, twisting, or sleeping on stomach.
Sleeping on stomach.
But it actually impacts
Not just for spine.
Acha?
So many things. Bad for your breathing, bad for your neck, bad for your hips at times. Nothing good comes out.
Okay. Quickly tell us a few exercises that people should do for their back.
The cobra position,
Acha.
Bhujangasana.
Okay.
The stretches, which I told you just now for the neck and back. And just even if you go for walks, any kind of aerobic exercise which is non-impact, this is good for your spine.
Okay.
But if you have pain once in a while, lie down on the ground, raise your leg close to the wall, then sleep on your stomach and do the Bhujangasana or cobra position. These are very good for most of the conditions.
Okay. Standing desk or sitting with good posture? Pick one. Standing desk or sitting with good posture?
Sitting with good posture.
Yogas or Pilates?
Both.
Back belt or core strength? Which
Core
do you
strength,
train?
core strength, core strength. No comparison.
3 words to describe your spine care philosophy.
Prevention better than cure.
Arey wow! One everyday item you would ban to save our spine. Don't say mobiles.
It is.
Your favorite quick fix for a back stiffness on a busy day. I need this. Please tell me.
Rest,
So नहीं हो रहा है sir.
stretches, which I told you.
Stretchings.
Yes.
Yeah. What is spine's biggest enemy? Stress, smartphones, or shoes?
Smartphones.
Okay. Heels or normal shoes?
Depends on your fitness.
I'm wearing one now.
See, moderate use is fine, but if you already have a lower back pain, it's a disaster.
So, moving on to the next question. Have you ever corrected somebody with a bad posture in the middle of a conversation?
I keep on doing it all the time, and sometimes I get a flack for it at my home.
So, you do it at home also?
It just happens at a spinal level, you know.
Spinal level, I love that. So, if not a spine surgeon, what would you be doing today?
I think I would be a naturalist, a wildlife lover, and a farmer as well with sustainable, production close to nature.
Arey wah. So, sir, tell us about some, case that you operated, which is very close to your heart, which made you, extremely happy that you are doing this.
There are quite a few, but I will distinctly remember something, not just for professional reason, for on a personal level.
Acha.
Recently, just a few years back, there was a young girl around 11-year-old who was brought to me on a stretcher because she had almost lost the power in the lower legs, and she had this lesion in her spine, a tuberculosis, but at a level where it is really risky to operate without expertise or technological demands. And once you lose complete power, we cannot say how much it will regain. More importantly, the family was extremely poor, didn't have enough money, and they were in a government hospital for a long time. In spite of that, she was not recovering. Rightly so, the people at least did not undertake a surgery without the expertise they were trying to follow. By the time she came, it was a little advanced condition. So there was no other way but to do a complex reconstruction, both in front, from the back, and everything. So we managed to do a single stage using the best technology, the ORM, AI technology, and everything. The hospital also came up with a complete support as far as finances are concerned. And what I still remember is that girl on the stretcher asking me, Dr. Saib, मैं वापस चलूंगी तो?
Oh my God.
And everybody in the family was crying that time, So suddenly you are, reminded, we tend to judge our success today in numbers.
True.
How many surgeries, amount
True.
of check, growth, all those things and
True.
revenues. But being a doctor, being a surgeon goes beyond that. Around that time, I was having second thoughts about, whether I should be doing so much work or still continue. After a certain age, you require time for yourself and have pursuing hobbies and all that. This was a very, very important thing in my life that I was reminded that you don't work just for all these reasons, which today success means. Sometimes it's important that you have to look at such people. And if you are in a position to do the surgery in spite of somebody not having the resources, that's definition of success for me.
True. So true.
The girl recovered completely. Few months down the line, she bought a small card
Acha.
and a little bit sweet.
So sweet.
So these are the things which you take back from my profession. Correct? There are people in every profession, most of them earn much, much more than what today probably doctors like us will do. But what we gain is this kind of gratitude and this kind of feeling that you have made a difference in somebody's life.
So such a nice story to hear, I must say. So sir, This is one of my favorite questions that I ask my doctors. Your schedules are packed, either OT, OPD, patients, follow-ups. What do you do to rewind yourself after a long, tiring day? How do you get back on track?
The most de-stressing thing for me is to spend time with my son and my two dogs.
Acha,
I mean, just being with them after going home, converse with my son and playing with my dogs gets me off. Then they exercise.
acha,
Fortunately, my son shares the same passion.
acha,
So many times our conversations are in the gymnasium,
acha.
right?
Okay.
I have other hobbies like wildlife photography and
So you go
camping and
for
all.
wildlife photography,
It's a challenge in life. To find time for your hobbies
true,
is the more
true.
challenging thing than growth in your profession.
True, very true. So, what would be one message, again, one message that you would want to give to all the aspiring doctors who are looking up to taking this as their profession?
Take care of your health first, both physical and mental. Things are changing, they're more challenging. If you are successful, also, it is going to be very, very stressful on your psychological profile as well as your physical health. So, right from the start, develop that toughness, develop that fitness, that then you can only focus on the patient's health and you're not worried about yours.
Wonderful. It was a wonderful discussion, sir. And I think we have spoken so much about the postures and things that needs to be done for the right spine issues. I think there are much more to be covered in this, but this is what we could cover. And thank you once again for giving me this opportunity to, have you on this podcast
Thank you,
and this
Dr. Tushita. I
information.
think pleasure is mine because you gave me an opportunity to share whatever little I know about spine care and few other
Thank you,
things.
sir. Thank you
Thank you so
so
much.
much.